I'm delighted to tell you that we are launching the Environs Ventures Health and Wellness Fund. So what does that mean actually for you? Well, helpfully, we've got a picture. The opportunity is to invest in a fund which will be investing in companies that are putting together this really cool combination of things. The kiosk at the back, which is supported by an app that can be loaded up with the data from the kiosk. It can be connected to your Fitbit or Strava or other wearable to gather all of that data into a single spot. We're going to be adding additional enhancements to that. We've got other products that we're attaching to it. And the grand scheme thought process of the fund is actually to be able to continue to add new functionality over the term of the fund so that you end up with a one-stop shop for information. We have the kiosk. We have the wearables. They produce data. We put analytics on the data, and ultimately we produce customized insights for you to improve your wellness. What's not to like about that? What's the value proposition of the fund? We're starting with established wellness in the workplace enterprises, which clearly already are revenue generating and have a history, not just of providing wellness in communities and in the employees that they're working in, but a rich source of data. We're also working with a very established community pharmacy group, currently based in the UK and looking to expand from 18 pharmacies to 200. And we're talking to a local pharmacy group here in Jersey to see if we can include that sort of thing in the fund as well. The synergies between the companies are already being investigated and leveraged so that we have put together a group of companies that allow each other to work together and create significant opportunities for revenue generation for each of those companies, far beyond what they would do individually, and importantly, driving more revenue generation opportunities for the investors. We've also, even more importantly, got an incredible source of data. Individual pieces of data from all of those companies that begin gathered together in a single place in the fund and can be sliced and diced and presented to people who want to purchase that data to give an absolutely unquantifiable additional value to the fund itself. We're working with Julian Box at Caligo to understand the best way to monetize that data, but that gives you immediate access to information that is totally mind-changing in terms of what people can do with it. The initial businesses we're looking at are listed here. We have WellPoint, which has the kiosk and the Well.me mobile app. That is currently being used on a white label basis by Bupa, called B.me, and over 230,000 users are using it today, with thousands adding it on every month. In fact, they're doing a big demo this week at a health and wellness event where they've got an enormous Bupa kiosk with a couple of our kiosks there. Importantly, it's not enough that we simply invest in the businesses. We need to have underwritten them and understand they really do add the value we want, and we need to be looking for new businesses to further increase the value. So part of the team and part of the funding will be Allen Labs, Dr. Austin Gibbs here in Jersey, and HEI, Dr. Richard Fote in Toronto, who have gone through the underwriting for the existing investments and will be available to do further underwriting for new opportunities. Looking for new innovation, creating the innovation strategy for digital opportunities in the fund, and looking for new investment opportunities on island in health and wellness that we can wrap into the whole package. Just a sample of some of the clients that our investment companies are already working with: Blue Chip, FTSE 250, and government. We want to revolutionize wellness in the workplace and the community. We want to bring employers together, offering opportunities to employees to improve their wellness, and offering connections in the community with pharmacies to ensure that we are giving access to every single person who needs health and wellness, whether they can afford to go to the doctor or not. We're working together, employers, employees, community pharmacies, to help improve wellness in the community and in Jersey in particular. The next thing we want to do, and we are starting to launch, is an impact initiative in Jersey. We are going to offer the Well.me app to every single employer, employee, former employee, retiree, and family member on island for free. We will be looking for corporate sponsors to have kiosks around so that people can actually sit on a kiosk, stand on a kiosk, and get data. All of that data will be put into a data trust. Every single employer, employee, community member who wants to access the information will be able to see on an anonymized basis how they compare. How do I compare with a woman of the same age and stage compared to the rest of our island? Why is this important? We are the perfect test bed in terms of number of people and in terms of the ability to gather that data and produce meaningful results. We can then export it. We, Jersey, can punch higher above our weight, and we can actually export incredible data opportunities and health opportunities to the rest of the world. Are you excited yet? Austin, can you come up? Dr. Austin Gibbs.
Hi, guys. Some act to follow that, isn't it? Yeah, I mean, I'm really excited about this for lots of reasons. I've been working in the digital health space quite a while. Some of you know me. Some of us have had some lovely COVID encounters. It's lovely to see Dan again. We haven't seen each other since the initial COVID breakout. And I think what we've established is that there's been a massive push for wellness. All right. The digital health landscape is quite an interesting one. It's not like other sectors. Medicine is the last area to digitize. I know this morning. I was in clinic looking for a cassette tape in order to dictaphone my notes. Who last saw a cassette tape? We are the last, we are behind, but what COVID has done is rather handily triggered this forward. Suddenly people are used to apps, suddenly they're used to being at home. Hospitals have gone, oh, actually, it's actually quite nice having data. The digital health landscape itself, however, is complex to get into. And it's difficult because you've got regulation to get past, you've got certifications that you need to do. In addition, annoyingly, the internet's a bit like the King James Bible. As a doctor, my Latin is no longer any good. Anyone can go looking for their health. Everyone can understand what their health means. We need to personalise our healthcare properly. Each individual is an individual, and we need to make sure that when we're doing our clinical cachet, people can access that. Prosumers, consumers, we're all patients, we're all carers. Am I clicking forward back? The wellness challenge. We talked about this in COVID, but the numbers are staggering. Prevention, which the government is very bad at doing, and the NHS is particularly bad. In fact, we would argue that the NHS doesn't just shut the gate after the horse has bolted. The NHS shuts the gate after the horse has run a few races, retired, had a nice time with some fillies, turned into glue, and currently been eating one of my toddlers in nursery. And then we go, oh! We've heard already about COPD, about seeing the patient the day too late. There isn't the appetite for prevention, partly because they're underfunded. 74% of all deaths globally from non-communicable diseases could be prevented, okay, or at least delayed. It's that simple. Years life lost, quality of years life lost. These are all things that we should be doing in advance of them becoming sick. There's predictive metrics, there's data, but fundamentally there's no real appetite in government to properly do prevention because they're crisis managing the result of COVID and everything else and running out of money. So corporations are going to be front and centre with this. What do we mean by wellness? People use that word a lot. I don't think they know what it means, to be honest with you. It's a bit like putting an I at the front of your pitch or an AI at the end. iTunes, iApple, iPhone, and then AI thing was to get money. People ban wellness around to get the cash. Really, it's been around for at least 5,000 years. There's some written evidence for it. Perhaps the most interesting thing you'll ever read is in the 1960s, there was a report on wellness in the workplace and how important it was to be a key strategy of companies. Now, I'm not sure if in the 60s that was probably making sure there was enough, Lucky Strike filterless and whiskey in the cupboard, but nevertheless, it was recognised then, and yet still now, wellness is something that corporations will have a tendency to go, we kind of need to tick that box. We kind of need to tick that box, but it's not really a key part of their strategy. Until COVID came along, and they went, well, actually looking after our staff and making sure they're well and happy actually is profitable and make sure that we maximise our staff. And that's the challenge, is there is a labour problem, there is a workforce problem. It isn't just about not having enough people to fill the boots, it's actually about skilling up the staff, retaining the staff, attracting the best. To do that, you've got to offer more than a fat salary now. You've got to offer, as an employer, a proper care from cradle to grave. The Niall Bevan stuff, that's now falling onto corporations rather than onto government. Partly that's funding, but partly it's because corporations are smart enough to see you look after your staff well and you make sure they're well, they will be engaged, they will perform better, they will stick with you as a company. That DNA, that attitude. We heard from Aaron about how his company went a bit awry when he lost the DNA. That's part of wellness. That's actually part of what wellness really means. In Jersey, it's magnified because we're small and we have less people. Probably not aware of just what an impact our long-term sickness has. We effectively lose every 10 years 2,500 skilled workers to long-term sickness. Now, for a population of 100,000, and we've heard, Aaron said I had to put my office in London, I couldn't get the expertise. That is a real problem. We've got the expertise. They're probably sick. They may well be sick, and we need to look after them. So this Wellness in the Workplace initiative is really exciting. Okay, we have the opportunity, and Heather Ann has already talked about it, of pushing it out there and getting all that data. Briefly mentioned about this innovation pipeline, which is where the Allen Lab sits. And I think that's a really important part of this. The central part of this fund is established businesses that when we put them together, leverage much more power than they did on their own. And they do that through the creation of a data trust and that data and those insights. Dan and I have talked long into the night many, many times about data, and one day he'll have to tell you about Oxygen Gate. And in addition, we want to feed in innovation into that sector. But the digital health landscape is difficult. So what we've got is an incubator and accelerator with the Allen Lab and the Toronto, that where we find these brilliant young individuals with these great little health or wellness inventions, we've got an opportunity to stress test them, to work them through, to find out exactly what the hurdles might be to regulation, to even run the trials here in Jersey, and then say, do you know what, this is a goer. And finally, and this is the key bit, it lands in our own market clients, so we then got market deployment. Adds value to those in the fund, great. But it means we can sell it worldwide. Because many of you will have come across this problem. When you've got an innovation, can we talk to another client? Can we talk to one of your other clients? Who else is doing it? No one ever wants to be first. Everyone wants to be second. No one wants to be third. And I'm sure, Ian, you've come across this a little bit with patient 37. As you're trying to get it going, you kind of come up to think, who else is using it? Where is it deployed in market? You need that kind of market data. So I'm going to hand across now to Stan, who has been doing this much longer than I have, but equally is passionate about this personal care record and making sure that we look after people correctly.
When he says I've been doing it longer than anybody else, he's just referring to my grey hair, but it's a dye. I'm naturally black. As is also obvious, I've won Bart's Best Quest prize for tonight. The bad news is my prize is that they've given me 5 minutes to tell you about the global explosion in digital health, okay? So sit up and listen, okay? I'm Dr. Stan Shepherd, a former GP, but my first degree was aeronautical engineering, which I did for 10 years before going to medical school and becoming a GP. So I've always had one strong foot in technology and one strong foot in medicine. I was one of the first GPs to computerize my medical records, and I was one of the first users. I sent my letters back as everybody did. Your software is crap. But my letter said, your software is crap, but here's what I think you should do. And they made me a consultant and so on. So we've then, I've combined the two careers since. I'm founder and CEO of Instant Access Medical, a medical software company. In 2003, we became the global partner for Special Olympics, which is the biggest sports organization in the world for people with intellectual disabilities. They run about 75,000 sports events every year worldwide. And from 2003 to the present, they've used our software in every US state and 80 other countries to capture the health screening data into a single global database we developed and managed for them, which to this day is the richest, most comprehensive global database on the health parameters of people with intellectual disabilities. So you can't out-ESG me. We know from that Special Olympics experience that putting the athletes' health data in their own hands, or the hands of their caregivers, gave them a better way to manage their health. We soon realized that all of us would benefit from our own person-held, person-owned, lifelong, comprehensive personal care record on our mobile phones. The reason is very simple. We all know that good health is not something that just happens. It has to be created and managed just like your wealth, okay? And I'm also going to do a BART, all right? You ready for your questions? I told you to sit up. Stick your hand up if you think your health is more important than your wealth. Oh, it's only 100%. We've all got lifelong records for our wealth. Stick up your hand up if you've got your own lifelong records for your wealth. Come on, of course you have. Credit card statements, bank statements. We'll take that as 100% as well. Now stick your hand up if you've got a lifelong record, your own lifelong record of your health. 1, 2. It's pathetic. We just agreed 2 questions ago that your health was more important than your wealth. Almost no one has a lifelong record for their health. Instead, our health data is scattered over all the doctors, clinics, hospitals, etc. we've seen. But what do you do for your travel, your finance, and your insurance? You manage all that on the relevant app on your phone. So we could all be managing our health on our phones, and we soon will be. The digital health revolution, I'm nearly up to my 5 minutes. The digital health revolution is here. It's well and truly arrived. What Austin didn't do was give me the clicker. Oh, Helleran, you got the clicker. Would you like to be my clicker? Oh, you have. That's called look behind you. Our personal care record is based on our global experience with Special Olympics. It's comprehensive, multilingual, and lifelong on mobile phones. It can be updated directly by individuals themselves, by doctors, by nurses, by pharmacists. It can be automatically updated from provider systems, physician systems, and from remote devices and wearables. That is probably the biggest growth area in health. Ian said it, and he's absolutely right. We don't wait for the wheel to fall off our car before we get it serviced. We're long past the day when we should be waiting for symptoms before we seek any medical help. And data-driven healthcare is going to present that data, I hope, in the first instance to myself on my mobile phone, and then I'll decide to share it with whichever physician I choose. The personal care record doesn't just store the data, it automatically analyzes the data in the record, collates that data, makes it come alive, and creates personal care pathways specific to each individual based on that data. These care pathways then automatically deliver personalized, interactive, proactive alerts, reminders, and follow-up for the actions you need to take to get your best health outcomes. And that's long-term conditions, it's autoimmune diseases, it's cancer, it's you name it. The record also supports our well-being programs, health promotion, information resources to empower the individual for self-care and self-management. WHO announced ages ago there's an irreversible global shortage of healthcare professionals. No country has got the capacity or the budget to create all the healthcare professionals they need. Every healthcare system is going to have to move patients from passive recipients of care into active managers of their own care. And none of us can manage anything unless we've got the data. And the best place for your data is on your mobile phone. Where relevant, and with explicit consent of the patient, we believe fundamentally that the patient is the primary data owner. That data can be shared with healthcare providers. On the right-hand side here, it can be shared with healthcare providers, with corporates, employers, and the de-identified data can be shared with the employers to give them a real-time health status across their workforce and how it's changing. We know from wearables like Fitbit, and it'll be the same with that separate data storage and multiple different apps leads to a decline in usage. People want their health and wellness apps and services all integrated in one place rather than scattered across their phone or scattered across the internet. And of course, COVID has brought into sharp focus for employers the unmistakable, they've talked about it for years, as Austin said in the 60s, but COVID has shown them that if you don't take care of your health, the health of your workforce, you may have no work. You may have no business left at the end of that. So it's now high on the agenda, and this initiative couldn't be better timed. Therefore, our personal care record can integrate the offerings of all the companies you saw outlined when Heather Ann showed the slide, integrate the data of all those companies for the benefit of both employees and employers. He did it. The personal care record brings all this together. Where's the logical place for Ian's information? It's not in GP systems, it's not in hospital systems. Much of it, establish that baseline, is going to be normal. It belongs in my personal care record. It belongs, and the first person to be told about any variations should be me. So we can bring it all together. With WellPoint, we will integrate the data collected from the kiosks in the workplace, from the WellMe app, into the employee's personal care record. It's the natural next step, and it will benefit both the employees and the employers. It will improve outcomes, especially of the long-term conditions that we mentioned earlier, diabetes, hypertension, heart, lung, kidney disease. It will improve prevention. We've got to stop fixing it after it's broken. We've got to make prevention the top of the agenda, and we can reduce absolutely both short and especially long-term absences, and of course improve productivity. Go and get a personal experience over there. We've also worked with, we're working with pharmacies and laboratories to coordinate all their information and bring that. Pharmacists are a much underused resource in healthcare in the UK. They have no access to GP data at all, which is bonkers. So they should also be brought into the circle, and we could integrate all of that into your own lifelong personal care record. 4 minutes, 59 seconds. Thank you.
Thank you, Heather Ann Austin. I want to.
Yeah, I just, from my point of view, it's a long night, so I just wanted to summarise so we're just very clear what we were talking about, because yeah, it is actually really, really exciting. So the core of this fund is established businesses with blue chip clients that we're synergising together and leveraging the data therein. There is a pathway to digital health innovation through the incubator and accelerator and value, and then there's a path to the global market. This is data-driven well-being. That's the innovation here. That hasn't been done before, not properly.